Good evening. I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. St. Lucie Recovery Works is an initiative supported by the Florida Department of Economic Opportunity. My focus is to connect the social service and treatment service providers and the judicial and law enforcement systems to the workforce development community with the goal of improving employment outcomes for people with substance use disorder. In the United States, nearly 1 in 3 adults has a criminal record, which limits their access to education, jobs, housing, voting, and other things necessary for a full and productive life. These men and women face some 44,000 documented barriers to success, in addition to widespread social stigma. According to the National Institute on Drug Abuse, opioid use disorders are highly prevalent among criminal justice populations. According to data from the United States Department of Justice, approximately half of state and federal prisoners meet criteria for substance use disorder. I bring attention to these statistics because April is National Second Chance Month. Peer workers and peer recovery support services have become increasingly central to people's efforts to live with or recover from mental health and substance use disorders. Community-based organizations led by people who have lived experience of mental health conditions and or who are in recovery from substance use disorders are playing a growing role in helping people find recovery in the community. Acknowledging that this is Second Chance Month, I am so pleased to have a shining example of an organization and team that are providing the support services to addressing the needs of returning citizens as well as those working on their recovery. I'm proud to welcome my colleague and friend, Barbara Moody-Holbrook from RiteLife Services. Barbara, RiteLife Services is a recovery community organization and peer respite with peer services. What does that mean?
So the state of Florida, with the state opioid response money, developed recovery-oriented system of care model. With that model, they have included the recovery community organizations, that's RCO. So this model, we have looked at other RCOs throughout the state of Florida to see what they were doing, and we just kind of went off on the deep end ourselves and created this model. We have one RCO in Okeechobee, and we have a new one that's opening up in Port St. Lucie. The peer respite is a model that I located several years ago in California. The sheriff's department were receiving people who were Baker Acted or possible people who were being incarcerated for minimal charges, maybe vagrancy, homelessness, trespassing.
Baker Act, people may not know what that means.
So Baker Act is somebody who is being taken because of their mental illness, and they might be acting out, or they might be showing some hostility or some agitation, and they might even be court ordered for a Baker Act. And that means that they are assessed. They are taken in handcuffs to the crisis stabilization unit. They are assessed and determined if they need to stay in that crisis stabilization unit for up to 72 hours, where they are in a room in a gown.
So it is for their protection, and it is for the protection of the public.
Correct.
When this happens, but that's when you have the opportunity to step in and hopefully help them find some resources to be able to address whatever it is that they're going through?
Yes. So as a peer, we are able to go in and support these individuals. You know, just for them going in the backseat of the police car in the handcuffs can be rather traumatizing for an individual.
Yeah, I can imagine.
And then also going into a small room, placed in a gown and not being around other people, they are, disassociated from the population, and that makes them feel indifferent. So we as peer agents go in, talk to the individual, let them know it's okay, that we're here to support them. We understand what they're going through. We try to support them to get through that process. And then the peer respite comes in handy, because if that individual is not allowed to go back to where they were living, say they were living with mom and dad and they got into an argument and mom and dad said, we don't want you to come back here and live any longer. Over the age of 18, we are allowed to work with them and then bring them to the peer respite where they can live up to 90 days.
And while they're there, what activities are you working with them on?
So we are providing peer support every day. We are there to check in on them. We are getting them connected to mental health medications if necessary. We are also getting them connected to Vivitrol injections if they're coming from the detox facility or treatment facilities. We are getting them connected to medicated assisted treatment through Pinnacle Wellness and New Horizons of the Treasure Coast.
Okay. And then once they are stabilized with whatever support is really what they're needing, then you begin to work on the life skills part with them?
We do. We have groups every day. We have a fine young volunteer, Ron Haywood, that comes in. He has lived experience. He can come in for less than 40 hours a month to run groups. We also have Serena, who will be sharing soon. She is our manager at the Pier Respite. She also runs groups, works with individuals on budgets, monitors what's going on with them, gets them to and from appointments, helps them learn how to cook, how to socialize with one another. So she's a big asset there. And again, all of the staff that work at RiteLife Services have lived experience. So it's lived experience either in mental illness or substance use or parents who have had the child investigated or removed from the home.
And as we learn and we talk with this team, I know you brought a couple of members tonight to share their stories and the work that they're doing. And all have been reunited with family now and repaired relationships and are in strong personal relationships. So that living examples also of once you go through this process, how life can be beautiful on the other side of it.
Well, I say they, but we all model and we all teach one another. It's funny, I was just having that conversation earlier with one of the staff that we come to and then we come to and then we come to again because we teach each other how to live life without the use of drugs, how to become responsible, how to live life without all of the chaos from relationships, and how to just love people where they are.
So beautiful and so needed. And you're making such a difference in our community. And I understand it isn't just the staff, but even your board is comprised lived experience people from all walks of life and all occupations.
From all walks of life and all occupations. And I would say that we have had a larger hand in everything that's come together with RiteLife Services. Our board are accountants in CPA office. We have an individual who works for the public defender's office. We have an individual who owns his own business and is in recovery. We have other members who are Oxford regional chairs.
So Oxford, that's a sober housing model.
It is. Oxford model has been around for many, many years. Florida actually invited Oxford to come into Florida. So Department of Children and Families made a contract with Oxford House, and they have come in to not be FAR accredited, which FAR is the Florida Association of Recovery Residences that's monitored by the state of Florida and the Sober Task Force. So they are leasing out rooms for individuals to live in, to be safe and learn how to live a life in recovery and be able to obtain employment. And that's where your services kick in. Because of the Crosswalk program, we are able to send these individuals to CareerSource and have them access employers that will work with them.
I actually have had the pleasure of meeting with local regional Oxford residents and was able to introduce them to the resources at CareerSource Research Coast. So thank you for bringing that up. The Oxford model, I think, is such a beautiful story because it's self-governing. The people who live in the house manage the house and the expenses, and they're mandated to also put a few dollars aside to start to have some savings. So they're really repairing their financial history as well as preparing for the future. That's a terrific resource in our community. And if there's anybody out listening who's looking for housing, I encourage encourage them to look at the Oxford model. There may be waiting lists. You never know. They also could have openings because people are graduating. They're moving on. As I talked earlier, they're getting into new relationships and could be moving out. So we've talked about your staff. What would you say is the philosophy of your organization?
So years of experience has given me this opportunity. So everywhere that I have been in my entire life brought me to this. So living the life that I lived in addiction and not being treated for my mental illness on a personal level. I had been living in the street, homeless for a number of years. When I finally got clean, stopped using drugs. I was introduced to a 12-step fellowship that I was joined and learned how to live life without the use of drugs. And I also learned how to live life to medicate my mental illness and obtained therapy to work through some of my trauma issues. Through that, I became employable. Imagine that.
Well, I met you 11 years ago. We were former colleagues together.
Yes. So what led up to that is I have worked in substance use treatment, private treatment. I worked for a builder full-time where I was expediting permits to build single-family homes and had to be professional around the individuals who were purchasing the home. So that taught me about people and those relationships that we build. I then was employed over at the Lord's Place down in West Palm Beach and working in their homeless agency, serving individuals who were homeless who were also drug users in their 51-man bed homeless facility.
And that's where I met you.
Yes, it is. So I had been given a lot of tools through that experience. I will say one of the tools specifically is SOAR, S-O-A-R, which is SSI, SSDI, Access Outreach Recovery. And that model allows us to file SSI, SSDI applications for individuals in an evidence-based model. So it's not willy-nilly. It's a higher level of filing these applications where we do all of the work and we do not let the individual do any of the work.
You not only are qualified to complete SOAR applications, but you now train other people to do that, right?
I do. I am the SOAR local lead for Circuits 15 and 19. Matter of fact, the managing entity, Southeast Florida Behavioral Health Network, brought me on a number of years ago as a staff to actually advocate in our community for other agencies to be involved in this evidence-based model of SOAR.
All right. I know it was pretty significantly managed in Palm Beach County, but the Treasure Coast was lacking in some of that support and resources. And you're the trailblazer up here, lady.
So so RiteLife Services actually has 4 staff members who have gone through this SOAR online course.
Okay.
And they are now trained in actually submitting applications currently and working on them.
So let's talk about why that's so significant, because once somebody does qualify, they have ongoing income. They have resources to be able to get housed and to be able to get medical treatment and to be able to really have the basics of beginning to repair their lives, right?
So I'm a storyteller.
Okay.
And I will tell you a little story about a gentleman named Larry. And I would watch him for years when I worked at the Lord's Place. And I would see him riding his bicycle every morning to go to the recycling center to work, where he just worked enough to go and buy 6 packs of beer and go home to a lean-to shed where he slept outside. And I watched him for probably a year and a half, and I kept seeing him get grayer, his skin tone, he was pasty, he was starting to look extremely disheveled and out of sorts. So one day I called him over and said, "Hey, come over and have a cigarette with me." And I don't smoke. So I gave him the cigarette. We sat and talked, and I filed Social Security income for him that day. Within a month, we had that approved because his physical illness was so severe that they approved him right away. They, being Social Security Administration, approved him immediately, and we got him in to see a doctor. And the best thing that came out of that, not only did he have Medicaid, but he put a motor on his bicycle so he could actually ride the bicycle, because his health was deteriorating so significantly that he had to start walking his bicycle because he could no longer ride it. So stories and watching an individual's life change significantly because of their having some kind of income.
Right.
And for the community, I mean, if you think about an individual who is going into the store that is stealing a beer or stealing a pack of cigarettes or stealing a sweater, they now have income to go and purchase that. So now they become a member of our society that is productive.
Right. And the burden on the medical system for emergency situations, there's
pay.
Compensation. Exactly.
Sure, there's compensation.
So that's great.
And the recidivism for the reentry system is decreased because they're no longer going in and out of jail for trespassing because we're getting them housing and medication.
Right. And even though somebody is receiving Social Security benefits, they can still work.
They can still work. Absolutely. Yes. That is one of the best programs of all because, you know, the old myths have it that, well, I got my check and I don't have to work. Well, but you can because it provides so much self-worth. It provides productivity. Socialization. People just thrive when they have some place to go. I know on a lot of the assessments, they ask, do you have any planned activities once or twice a week or 3 to 4 times a week? And when we meet these individuals initially, we write on that assessment that we have no planned activities that bring us joy and peace.
It's so interesting because there is evidence that people who have a purpose, whether it be paid work or even volunteerism, that really helps to support their recovery as well.
Absolutely.
Yeah. So you talked about how SOAR and your initial work working on that men's campus sort of opened the door for you to find your passion, really, find your purpose. And now through that employment journey, you just have continued to build resources. This organization, you have 3 locations?
Yes, RiteLife Services has 3 locations to date. You know, and it's been through every agency that I've ever been employed with. The Lord's Place, Southeast Florida Behavioral Health Network, and Love and Hope in Action and Stewart. The relationships that I have built along the way mounds up to the opportunity to have these grants to help other people and be able to really do the work that I love to do where I'm not in a box, that my staff can say, hey, I saw this guy over here at the gas station and I'm all on, go and engage him.
Yeah.
There's no questions asked about anything. Just go and see him and let's see what we can do to help.
Build a trust, build a relationship.
Yes.
You, to me, you're the queen of outreach. I mean, I have watched you for years in action. And
thank you.
And you have a way to just sit with somebody calmly and build a trustful relationship. I know that the staff that you've gathered around you have that same compassion and that same skill set, which it's amazing to watch. So Okeechobee is one location. If somebody is looking for how to connect with you.
Yes.
Okay.
So Okeechobee is the recovery community organization. We have AA, we have NA, recovery groups. We will be getting trained by the Hanley Foundation to support family members and friends of people who have overdosed by a support group called GRASP.
Okay.
We will be trained in that soon. We also have...
And that's on 202 Northeast 2nd Street?
Yes, 202 Northeast 2nd Street, Suite 5. You can't miss us. We have our window wrap up.
I've seen them.
It's a standard, right? So,
yeah, and you were welcomed into that community. I was there for the ribbon cutting, and to see the Chamber of Commerce come out and all of the local politicians and the Sheriff's Department,
yes.
Police Department, it's a wonderful resource in that community. It was really needed, and everybody is celebrating that you're there to provide these resources.
Oh, we have absolute great relationships with the organizations, Recovery Village, Helping People Succeed, the Sheriff's Office, the Okeechobee Police Department. We actually provide Narcan to the Okeechobee Police Department to hand out.
Let's talk about Narcan. Not everybody knows what that is.
Okay, so Narcan is a tool to use if you have somebody who might be having an overdose from opiate use.
And it's inhaled. And it can't hurt somebody if they're not overdosing.
Correct.
But if they are, it can save their life.
Correct. So it never expires either. So you can have, it is proven that the Narcan nasal spray is successful at reducing overdose at 97%, even when it's 20 years old.
And you are a distributor for Narcan?
We are a distributor for Narcan, so we provide free Narcan. It's at no cost to the community or any of the agencies. So we will have the distribution center in Okeechobee at our location there. We also have our RCO that's going to be opened up May 1st, and that location is at 6646 South Federal Highway.
In Port St. Lucie.
Port St. Lucie. We're
Here
just off Kitterman and US 1. And so we will also have our window wrap that's going to go.
Oh, good, because I had a hard time finding it.
Yep. So we want to be seen. We want to be found. We want to be available for the community to come in and offer them free Narcan to take with them at no cost. We also have the Pier Respite that houses 6 individuals.
Right. And somebody would, that gateway would be through the RCO?
Yes. They can come to the RCO. They can look us up on Facebook, RiteLife Services on Facebook, and you can message me if you are scared or feel ashamed or for whatever reason. We want you to live. Like, we love you so much and we want you to live and we want your family member to live. So we will offer you Narcan. I will meet you someplace away from our agency if you have any type of, fear of being seen at our agency. We want to come to you where you are and hand it to you if that's something that we need to do.
So there are a lot of treatment organizations out there, and there are sober housing organizations out there. But I really would like you to explain why you're so different, why your organization is different.
Because not everybody wants to be housed. There are some people who do not want to be housed, and until they're ready, we just want to love them until they're ready. And we want them to have all the tools necessary to gain access to housing. And the reason why we are so different is because we will work with you, just as I mentioned a minute ago, that if there's some type of stigma related to you coming in through our doors, we want to meet you where you are and reduce any of the fear from you reaching out. We also will get you connected to any of the services that you're looking for. If you're looking for treatment, we will assist you getting into treatment, or substance use or mental health, either one. If you have a family member, we will work with that family member when they're ready. We also have a lot of connections with private treatment centers to where we can get you scholarship.
So we've covered a lot of information today. I just want to add a few more notes. To reach RiteLife Services, it's ritelifeservices.org. Career Source is an employment resource for anybody who is accessing services in the community and needing employment or wanting to look at training opportunities. And I can be reached at Lyon, ELYON, at careersourcerc.com, or you can visit the Career Source website at careersourcerc.com. We are going to be having a April 30th Treasure Coast, actually, Drug Take Back Day. The location in St. Lucie County will be at the Fort Pierce Maine Police Department on 920 US 1 in Fort Pierce, and there will be special drug deactivation kits that will be handed out. But you also, if you have any kind of household medications that you need to dispose of, please feel free to visit. If you are not comfortable reaching out to RiteLife Services, although I can't imagine that you wouldn't be, but if you're in crisis and it's Saturday night, please 211. You can dial on your phone at any time, 24/7. They don't provide services, but they will direct you to whatever services may support you in whatever your crisis is. Or you can go to 211.org on a website and somebody will chat with you there. Barbara, thank you so much for helping to provide solutions for the most vulnerable in our community. We're privileged tonight to have 2 additional staff members from RiteLife Services. And next I welcome Serena Snyder. Welcome, Serena. Serena.
Hello.
What is your position at RiteLife Services?
So my position at RiteLife Services is a peer specialist, but I also am the manager at the Pier Respite.
Okay, so what is a typical day at the Pier Respite?
So a typical day for me is I get there in the morning, I engage with my clients, ask them how they're doing, how their night was, just socialize with them, and then I do run a group for them with life skills, teach them like budgeting, things like that. And then I also take an hour out of the day to meet with each of them individually.
And why did you decide to get involved in this type of work?
I decided to get involved because I am also a recovering addict, but I am a child of addicts. I've been around addiction my whole life, watched it through all of my family members, and then I want to see everyone be able to succeed in life.
Well, you certainly are, and so admirable that not only are you working on your own personal recovery and building your career now with RiteLife Services, but also supporting our local community with other people that are moving forward. And so that to me is just a beautiful story. I know that when we talked earlier preparing for this talk, you had mentioned something about mental health court.
It's actually drug court.
It's drug court? Okay.
Yes, I am a drug court graduate, and honestly, I don't think my recovery would be possible without that.
So that's a deferral system to promote treatment and access to services as opposed to incarceration.
Yes.
And so you're the success story. You're the result of having somebody, not go to jail, but receive the support and the treatment and the services that they need. And here you are, a professional, giving back and working in that field. So future plans?
Future plans, continue with my sobriety and learn how just to be a better me and help.
Okay. And what advice would you give to somebody who may need help, or a friend or family member of somebody who would benefit from RiteLife Services?
The best advice that I would give is to reach out. It's hard when you're in that position to ask for help, but we are here to help you and we are here to love you. Wrap you around us, wrap you in everything that we can provide and just be here when you need us.
We keep talking about wrapping, and I don't know a better place to get hugs and support than RiteLife Services. It's RiteLifeServices.org is the website, and the phone number is 561-503-1323. So if somebody is listening, please take advantage. The ladies that are here today are just so full of compassion and creativity and solution focused and really can lift you up. So thank you so much for taking a few minutes to share your story with me. And next, I'm going to welcome Brenda Schmerling. So welcome, Brenda. You are going to be at that brand new Port St. Lucie location that we've been talking about.
Yes, I am. I'm very excited for the grand opening.
I know. So that is at 6646 South Federal Highway in Port St. Lucie. And again, you can find that at RiteLifeServices.org. What is your actual position?
I am a source specialist as well as a peer specialist.
So all of the activities that we've been talking about earlier of helping somebody to qualify for benefits, guiding somebody through the process of working on whatever resources are going to help them to stabilize their lives, you're going to help with all that.
Yes, I am. So I start with the SOAR application, applying for disability benefits, navigating the system for them. I had to apply for disability on my own, and it was very stressful and confusing and frustrating. So my position, I love it. I take all that away from the person that's filing.
And so I know you don't really have a typical day yet because you're not officially open. But what will some of the other activities be at that facility? There'll be groups?
There will be groups available.
I know
they will be announced shortly.
Okay. I know that also Career Source has committed to come in one day a week and work with job seekers, whether they are looking for job readiness and job search activities, or perhaps they need training. Maybe they don't have current work history or transferable skills, or maybe they were working in a field that wasn't so healthy for them to continue in. And if somebody is looking for retraining, Career Source Research Coast offers wonderful apprenticeship opportunities as well as on-the-job training opportunities. So that will be a very nice partnership. And why did you decide to get involved in this type of work?
First of all, I love people. Never thought I'd say that. During my addiction, I isolated most of the time. So, when I got clean and had some recovery, I found my passion that I just love people and helping people. And I guess my main reason is that I am what they call dual diagnosed, which means I suffer from drug addiction as well as a mental health disorder. And I'd like to break that stigma that, people have on us, that we do recover and live happy, productive lives.
Totally. And you mentioned a husband earlier.
Yes.
So you have a very stable relationship in your own personal life.
Right. And I have 2 wonderful grandchildren that I love spending time with.
Oh, that's great. You said that you're helping initially with some people who may be homeless.
Correct.
What do you do personally to stay positive and maintain a balanced life?
For me, it's, staying connected with people in the fellowship. I love my animals, so I spend a lot of time with my animals, my grandchildren, and doing things with my husband, going to the beach and just enjoying life.
You told me something about arts and crafts.
Yeah, I do like arts and crafts. I was an avid horseman person up until my recent accident. So before that, I was heavily involved in horses and found it to be very therapeutic when I first got clean.
So again, we've been talking about second chance employment. And why do you think that concept is important?
To me, I find it important. As my addiction progressed, my work ethics and everything else were slacking. And, I'm not that person I used to be. So if people based me off of my old version, I would have never gotten a second chance to continue to work and change careers.
I think you told me that New Horizons was your first job as a peer?
Correct. I was with the FACT team, actually.
And what are your personal future plans?
My personal plans is just continue on my recovery, my path of recovery. Definitely keep changing lives.
Okay. And what advice would you give somebody who may need help, or a friend or family member of someone who would benefit from RiteLife services?
Walk past the fear of reaching out. And we're not judgmental. We're not going to refuse you or judge you.
So as you've heard tonight, employment provides important structure as well as meaningful purpose for all people. But for people in recovery, employment supports long-term recovery associated with better quality of life, greater self-esteem, and happiness. And in fact, according to the Center for Disease Control, 3 out of 4 people who experience addiction will eventually recover. And these 3 beautiful ladies who joined me tonight are just living proof of not only building new lives, but giving back to so many people around them in our community. So thank you so much to all of you, Barbara, Serena, and Brenda. Stay tuned next month, 7:30, May 23rd, to hear more stories about recovery to work and all that is possible to be achieved. Thank you for listening.